From the below set of data, interpret the diagnosis of patient A and B as obstructive or restrictive type of respiratory diseases. So we have two data been given here, patient A and B. Patient A is having a vital capacity of 3 liters and FEV1 of 1.8 liters. VC is for vital capacity, FEV1 means forced expiratory volume in 1 second. And patient B is having VC as 2.8 liters and FEV1 as 2.6 liters. So how to know whether it's an obstructive or restrictive type of diseases? First of all, what is obstructive and restrictive diseases? They are the different types of respiratory diseases. And how to know it means we have a ratio of something known as FEV1 by FVC ratio. The forced expiratory volume in 1 second divided by the forced vital capacity, one ratio will get known as Stefano-Pinelli index. The normal FEV1 is 70 to 80%, and if it is going, the FEV1 by FVC ratio is going less than 70%, it indicates the obstructive lung diseases. Whereas if the FEV1 FVC ratio can be normal or increase in case of restrictive lung diseases. And the hallmark of obstructive lung disease is the FEV1 is always less. It is always decreased in obstructive lung diseases. For example, bronchial asthma. Whereas restrictive lung diseases, the FEV1 remains normal, whereas the vital capacity, the forced vital capacity decreases. For example, fibrosis. So that is some of the things you have to know before going to solve this problem. So how to solve this problem? The patient A, when you take the ratio FEV1 by FVC ratio, so we will get the value in patient A as 1.8 divided by 3 into 100. So we'll get around 60%. So 60% means it's coming less than 70%. So we have to conclude that patient A is having obstructive lung disease. And patient B, FEV1 by FVC ratio, when you take it is 2.6 divided by 2.8 into 100, we get around 92.9%, around 93%. So the normal value of FEV1, what I told earlier, is 70 to 80%. So 93% around we are getting in patient B. So that is the restrictive lung diseases. So restrictive can be normal value or increased FEV1 by FVC ratio values. So based on the following data and based on the equation, the Stefano-Pinelli index, the FEV1 by FVC ratio, we conclude that patient A is having obstructive lung disease and patient B is having restrictive lung diseases. So I told you about the FVC and FEV1. What is this FVC? Forced vital capacity or time to vital capacity. The volume of air that can be expired forcefully and rapidly following a maximum inspiration. So actually it's like 6 seconds. We have to expire forcefully and rapidly or forcefully and fast for 6 seconds following a maximum inspiration. So we get FEV1, FEV2, FEV3, FEV4, FEV5, FEV6. That is forced expiratory volume in 1 second, 2 second, 3 second, 4 second, 5 second, 6 second. We are considered only mainly for the diagnosis purpose, we consider only the first one, the first second, FEV1. So that is the forced expiratory volume, the volume of air expired forcefully in 1 second. That is normally 70 to 80% of the forced vital capacity. FEV1 is the single most useful test to detect generalized airway obstruction. The hallmark of obstructive lung disease is, especially like bronchial asthma, is decreased FEV1, where the FEV1 or FEV1 by FVC ratio goes less than 70%. And in restrictive lung diseases like fibrosis, though the vital capacity is decreased, the FEV1 remains normal. Based on PFT, the differences between restrictive and obstructive lung diseases are the following. Decreased total lung capacity, decreased residual volume, decreased vital capacity seen in restrictive lung diseases. And as I earlier told you, the FEV1 by FVC ratio is normal or increased in restrictive lung diseases. For example, pulmonary fibrosis, myasthenia gravis. And obstructive lung disease, the total lung capacity can be normal or it can be increased. The residual volume is elevated. The vital capacity is frequently decreased. FEV1 by FVC ratio decreases. And the hallmark here is the FEV1 is always decreased in obstructive lung disease. Example, bronchial asthma and COPD. So that's all about today. Thank you.